Imagine a world where a life-changing medication, proven effective for Parkinson's disease for over half a century, remains out of reach for millions because of where they live. This is the stark reality Dr. Michael S. Okun, director of the Norman Fiksel Institute for Neurological Diseases at UF Health, passionately brings to light in his call for global equity in Parkinson's treatment. But here's where it gets controversial. While complex and expensive HIV drug regimens are provided worldwide without question, Levodopa, a simple pill that remains the cornerstone of Parkinson's therapy, is often unavailable in low-income countries. How can this be? And what are we doing about it? In their groundbreaking new book, The Parkinson's Plan, Michael S. Okun, MD, and fellow Parkinson's expert Ray Dorsey, MD, lay out an ambitious, evidence-based framework designed not only to treat but also to prevent and slow Parkinson's disease globally. Drawing from their extensive clinical experience and research, the authors illustrate how everyday environmental and lifestyle factors, things like air pollution, diet, and water quality, play significant roles in Parkinson's risk. The Parkinson's Plan doesn't just highlight these influences, it provides practical, actionable recommendations aimed at reducing the burden of this neurological condition worldwide. What sets the Parkinson's Plan apart is its dual focus. It functions as both a prevention handbook and a treatment guide. From showcasing advances in medical science to integrating expert insights on technology and innovation, the book equips readers, patients, caregivers, and healthcare providers alike with clear strategies to slow disease progression and enhance patient outcomes. Their vision? To pave the way for a future where Parkinson's disease is far less prevalent and therapies are vastly more effective. In a recent in-depth interview with Neurology Live, Dr. Okun stressed the critical importance of early diagnosis and immediate treatment initiation. He pointed to decades of research confirming levodopa's safety and efficacy as the gold standard therapy for Parkinson's. Yet despite this overwhelming evidence, access to this essential drug remains frustratingly limited, particularly in low- and middle-income nations. Dr. Okun draws a bold comparison to HIV treatment worldwide. Antiretroviral therapies, even the most complex combinations, are now broadly available, transforming the lives of millions, regardless of geography or income. Why, then, is levodopa, an older, well-established, effective medication, not guaranteed to all Parkinson's patients? He argues this discrepancy is unacceptable and calls for targeted, country-specific action plans to ensure universal levodopa access, a major theme underscored throughout the Parkinson's Plan. This raises an important question. Are we doing enough to bridge these glaring treatment gaps in global neurological care? Could the lessons learned from the global HIV response be fully applied to Parkinson's disease with equal urgency and commitment? And where does responsibility lie? With governments, pharmaceutical companies, international health organizations, or all of us? Doctors Okun and Dorsey's work shines a spotlight on this urgent need and invites healthcare leaders, policymakers, and the public to rethink how we prioritize neurological diseases worldwide. The Parkinson's Plan is more than a book. It's a manifesto for change that encourages meaningful dialogue and active engagement with one of the most pressing health equity challenges today. What are your thoughts? Should universal access to levodopa be considered a global health imperative on par with HIV medications? Or are there complexities that justify the current disparities? Join the conversation and share your views on this critical issue shaping the future of Parkinson's treatment.